in the world. And it makes me very happy to be part of that process. Okay, now we're being streamed live. Okay, awesome. Here we go. Perfect. So we got a recording. We got a replay for those of you who are working right now and can't be here live, which is totally understandable. If you are watching on the replay, please let us know. I love to know that you're here and what your takeaways are. And for those of you who are live, I love it. Thank you for being here. Gary, Noel, Alexis is here. Who else is here? Roma, beautiful. Hi, everybody. Welcome. Welcome, welcome. Hey, Gary, thanks for coming on camera. I love to interact with you guys live. So if you're in a place where you can't be on camera, I totally get it, no problem. But I love to share with you and interact with you. So please come, and Kathleen's coming in too. All right, good. So please come on camera and feel free to ask questions at any time. Use the chat if you are in a place where you can't speak out loud. Kathleen in the house, love to see you. Hi. Yeah, for those of you who are new here, welcome. For those of you who've been here 100 times, welcome again. Welcome back. I'm Gina. I'm your trainer for the hour. I'm here every week to support you, movement and manual practitioners, and the work that you're doing. I love talking anatomy with you guys. I love talking client work with you guys. I love talking about just about anything in our industry, actually. I just had a beautiful phone call this morning about making a good living. I even like talking about that with practitioners because we all get to thrive. So anything and everything is on the deck for today. So please feel free to ask your questions. I can talk to a doorknob, so I don't need anyone to be able to talk. And I prefer to talk with you about something that matters to you. So if you do have a burning question or anything that's on your mind or something that I could support you with, please feel free to bring that up. And I'll invite you to do that now. If you'd like to do that, you can type it in the chat or you can come off mute and ask your question. We can actually start with Q&A today, which would be super fun for me. And if you're like, I don't even know who you are, why would I ask you a question if you're new here? I'm Gina Schatz. I am the developer of the Schatz method, which is a methodology to support both movement and manual practitioners to get to the genesis of the problem and resolve it for your clients, whatever their physical restrictions are that have been created by their lifestyle. We get to undo them. So that's what I'm here for. I've been in the industry for a while. Some of you have heard me say the number before, but I'm going to leave it as an open-ended question today. How many of you know how long I've been at the game? Which brings me to a really valid point. We sometimes don't stay in the game as long as we could. We burn out a little too quickly, and some of that is because we work too hard. It's also one of the bits of the conversation I had this morning. You guys, you can create amazing results for your clients that are long lasting, not just 4 days or 4 weeks, but like long lasting. Yes, Gary, you heard the number. It's been 30 years this year. Whoop, whoop. I know you can't tell. I've been at it since I was just a little wee one. Thank you for remembering and for braving a guess. But we can create like amazing results, you guys. You can be super proficient at long lasting, right at the root of the problem, eradicate the genesis of the problem, and get your people on with their life, with what they were doing without working hard. So this beautiful practitioner I was just referring to and talking to earlier this morning said, you know, right away, thumb strains as a manual practitioner. And, you know, I've talked to other movement practitioners where there's been injuries, where their students, their clients have left because they got injured from moving. Totally common, right? Doesn't have to be that way, but we can resolve all of that really easily. So if you guys are working really hard and you're also nervous about the work that you're doing, or you're not confident about the results that you create, then I'm welcoming you here, because it doesn't have to be like that. There's no way I would have made it 30 years if that was my lifestyle, unless I was a glutton for punishment, which maybe sometimes you could say I am, but really what I'm up to is I like to win. So I want results, and I want results that work, and I don't want to have to sell my soul while that's happening. So please, if that's all you get to hear today and that's a value to you, let that be your takeaway. I want you all to know that it is not only possible, but it's your right to work easily and create amazing results, and it's totally possible. So I'm here to share that with you. And on Tuesdays, I share tiny little nuggets. Lori likes to call it Tidbit Tuesdays. So we are here for an hour, but an hour goes kind of fast, and the body is, you know, an endless muse. So I like to share one little body's big. I like to share one piece of that with you while I'm here. And like I said, we can talk anatomy or functional anatomy or client work, or even professional development, which is a big piece of what we're up for these days as well. Welcome, Elizabeth. I'm glad that you're here. So what I want to talk to you guys about today, what I came prepared with, prepared for, you're not supposed to end a sentence with a preposition anyway, so I'm not sure which incorrect preposition is the correct one, but I came prepared today to elaborate a bit more on the before and after that I just sent out recently in the newsletter. I'm getting a lot of feedback from you guys that you like that before and after. So just props to Danielle, who recently graduated from the mastery program. That is her image. It was a client that she was working on and sent to me, and I sent back to her corrected and then trained her how to do the same thing. And so it was her genius that took that picture. I don't always remember to take pictures. So a picture is worth 1,000 words. And I'm so glad that you guys really liked that before and after. It was profound, right? It was super profound. So I wanted to elaborate a little bit more on that case study, because a lot of you have written me notes since then and said, wait a minute, what I just saw in that picture, you knew to fix that in one place that was like super easy. Yes. And it was long lasting. So I'd love to dig into that with you. How many of you that are here today would like to hear more about that particular case study? Who just came in? Somebody just came in. Nafia, welcome. I'm so glad that you're here. Who would like to hear a little bit more about that case study? Raise of hands. There's reaction buttons you can use at the bottom if you're here on Zoom, or in the chat. That would work. Gary, what is the most effective approach to physicians to develop a working relationship? This is a beautiful question, Gary. Okay, we could talk about that first. Absolutely. And then for the rest of you, let me know who's interested in hearing more about that case study. If it's not of interest to you, I'm not hurt about that. I want to be, my intention here every Tuesday is to serve you. So I don't need to hear myself talk, but I want to offer you value while you're here. So Gary, let's start with your question, with your specific question, because I love that. And yes, okay, great. So what is the most effective approach to physicians to develop a working relationship? So in my typical form, Gary, I always answer a question with a question first. And there's a couple of reasons for that. And this will support you actually in developing your relationships with physicians or clients or even people in your life. The reason why I answer a question with a question first is to make sure that I've understood the question. We can end up spending a lot of time and wasting a lot of time and confusing people, or even turning them off or away from what we're offering, if we're talking at something or to something that they're not interested in or haven't already connected to. So as far as like us, in your question, Gary, us approaching another practitioner and I want to develop a relationship with you, we can come at them in a way that feels like it's a fire hose, right? And if someone's asking you a question about what it is that you're coming to them with, you want to find out clearly, what is their question about? Are they, let's use your physician's approach as an example. If the physician asks you a question, rather than answering it right away, which is a little bit like performance, find out what is behind the question. So for example, if they're asking you what your credentials are, they might be asking actually, what results do you deliver? Your client could be asking the same thing. Clients never ask what your credentials are. They don't care. They care what the results are. And if the physician's asking what credentials you have, they might be skeptical about what you're saying. So you want to find out what's behind the question. If they're skeptical, you don't want to just go at them with everything that's good for you, because they're listening for the ways that it doesn't line up. So you won't even be in resonance with them in a conversation. So all that to say, I always answer a question first with a question. So what I'm wondering from you, Gary, is, are you currently reaching out to physicians and not getting the result that you're looking for? Or is there a reason why you want to reach out to physicians? What is it that you think a relationship with a physician will offer you? Or what do you have to contribute to them? So the reason why the answers to those questions matter to me is because I'd answer you differently. So I want to make sure I'm giving you an answer You're reaching out, you're currently reaching out. Okay, great. And why, Gary? What is the reason for you to want to reach out to physicians? Are the physicians orthopedic specialists? Are the physicians general practice who work with people with like chronic fatigue and muscle aches? Are the physicians, are you talking about chiropractors? What type of physicians are you currently reaching out to, and what is your reason for wanting to reach out? Oh, liposurgeons. Okay, totally different, right? Like that's not musculoskeletal, that would be more like lymphatic work. Is that the work that you do, Gary? Are you doing lymphatic work and you want to reach out to liposurgeons because you know that you could do post treatment, both what? One word, one word over chat is like super fascinating because I get to mind read. Both what? Share with me more details, Gary, than one word, so I can be in conversation with you. So you're reaching out to liposurgeons, and is that because you think that you have something to offer them post-surgically, or are you working on prevention from surgery? Those would be very different enrollments. You'd want to speak to a physician differently about them, because one of them could sound like you don't agree with what they do. The other one could sound like, to them, if they're skeptical, could sound like you think that they're not thorough enough. So just, you got to be in the other person's shoes and what they're hearing, especially in the day of cold calling, right? Like if we're just reaching out. So you want to find out your intent, your come from, like what are you thinking you have to offer, and why do you want to offer it to a physician? Yes, I have post-lipo experience. Okay, great. So you want to do post-lipo, and that's why you're looking for surgeons who do that type of corrective work. Okay, great. So how have you been reaching out so far? Has it been over email? Has it been by phone? Have you dropped in on their office? There's pros and cons to all. And this is what I'll share with you while I'm waiting for your answer. Dropping in someone's office is very courageous and also very professional. Phone so far. Okay, awesome. Dropping into their office puts a face to the name, and it matters what your presentation is. You want to be respectful, you want to be professional, you want to look the part, etc. You don't want to look frazzled or harried or be too casual, especially in a physician's office. Phone is great, and there's usually a gatekeeper in a physician's office, like meaning you probably haven't, I'm guessing, Gary, you tell me if I'm accurate on this guess, but have you actually talked to a physician, or have you only been talking to the gatekeeper and not getting through past the gatekeeper? Because that's different, right? Like getting through the gatekeeper is not the same as talking to the physician. They're different conversations. So that would be my next point of clarity. Only the gatekeeper, right? Okay. Yep. Could have guessed that one. I think I did guess that one. And emails are lovely, you guys, because you get to craft your email and make it sound really professional. And my experience with emails is that emails don't open doors. Emails put your name in front of someone's eye, but then you need to do something with that. Once they see you, you need to do something with it. Don't wait for the whole world to open up, pouring, gold coins out of a rainbow from an email. I just promise that people need to discover you after, and what you're up to and what you mean by what you said in the writing. And they want to connect person to person. Believe it or not, even in this day and age, we really do want to be people to people, which is why you guys are here live, and why it's less comfortable for me when I'm talking to a screen. I'd rather talk to people. So all of us are like that. We're inherently wired for connection in that way. So if your come from is, back to your specifics, Gary, if your come from is, I have experience in post-surgery, post treatment, depending on what type of depth that you work on. If you have experience there, what is your come from? Are you going to the physician to try to get something from them? Because if that's the case, like get to check in on your heart. If that's the case, even a little bit, if your come from is what can I get instead of what can I give, people read energy even when they're not aware of their own energy. And that might be why you're not getting through the gatekeeper. So your come from gets to be, what do I have to offer? What is the benefit and the value add to the physician for even bothering to talk to me? And then what is the value add once they are talking to me that I will offer to them that will be benefit to their practice? See, because they don't need you if their practice is successful, But if you think that you need clients and that's why you're going to go get them, that's not an equal resonance. So there's no value for value there. It's one person taking and one person giving. And so that's a really hard place to sell from, if you will. So what is your value add? What's the generosity that you offer? You're on the same wavelength as what, Gary? You're on the same wavelength as me, or you're on the same wavelength as the physicians? If you're on the same wavelength as the physicians, then what is your value add? What are you saying to the gatekeeper that you have to offer that the gatekeeper's not? Oh, you're on the same wavelength as me. Okay, great. So then come up with that, right? Get like super confident and clear. What do you have to offer? But not what do you have to offer. So hear me on this, guys. This is part of messaging, actually. We talk about messaging and marketing. They're two different things. We talk about both of them at length in my mastery program because it's a big deal, right? Like what you're sharing, Gary, is so valuable. Like, I'm wildly talented and I have something huge to offer, but nobody knows that unless I can communicate that. And we communicate through our messaging in what we say and how we interface, and also in our marketing, what we put out there that doesn't include us with it, you know, social media posts or ads or flyers or what have you, websites. So you get to be really clear in what is the value add to the person that you're enrolling and what you have to offer, and not spend a lot of time on how great I am. Now, I know that you're great or you wouldn't be here, because I tend to attract great practitioners. So I already know that you're great, and you get to know that you're great. If you don't know that you're great, any of you, not just you specifically, Gary, but if any of us doesn't know that we're great, we will tend to sell ourselves and pitch how great we are because we're not clear on that. But when you're clear about your value and you're confident about that, there's no urgency around that. It's a different energy frequency. It's a different, like, wow, something amazing just came into the room with me, instead of what is this energy like a fly trying to get my attention, right? So there's a different, and I'm being a little bit dramatic just for effect here, but you get to be really confident about what it is that you have to offer and not need to sell that. But do focus on what is the end results, the benefit of your wild success and skill. What is the benefit of your skill to them? Not how great are you, but what does it offer their practice? So what would that be, Gary? Would you tend to lower the work from their nurse practitioner? Would you allow their patients to feel more confident about going through with the procedure? Is there something that you know about? I don't do lipo post-surgery stuff, so it's, you know, it's in an adjunct lane to what I do, but these are the types of questions. What do you know about post-lipo surgery that the patient experiences? Better results and less pain. So less pain is for the client, which is with the patient, which is brilliant. Better results, though, is for the doctor. So what type of better results? Meaning specifically, how, without making the doctor feel like you don't think that they're capable or qualified or good enough, they're very good, they're very qualified, or they wouldn't have a busy practice that you're hunting, right? So, and they know that. So how much better would the work that you do contribute to the results that they already deliver to their patients? What's the clear add-on value that you offer that wouldn't be offered otherwise? So, and so hear me on this, guys, right? Like, there's a distinctive difference between, like, well, your patients should just want this afterward, and you should tell them that they should want this, and then I will do the service for them. There's no value add for the practitioner, for the physician in that sense. However, if what they do is, I'm going to use the word limited. If what they do is limited because they don't also do the work that you do, then you are offering to them, as you collaborate with them, not take from them, but as you collaborate with them, you're offering them more well-rounded results that they can then measure and use in their results and in their testimonials and in their data. And that matters to them. So it looks better, it's faster recovery, more likely to come back. Whoops, the chat just disappeared. Hold on one second. What did you say, Gary? So their work, the physician's work looks better. That's a value add for the physician. Faster recovery is mostly for the patient, and they're more likely to come back for more surgery is definitely for both, and that's a nod to the physician. So what I would say is, as we all are looking to network and partner, that's the word that we use inside of our academy, partnering for a pain-free world. As you're looking to partner with another colleague who does adjacent work to the work that you do, you want to find a clear path of benefit that you can articulate to them and literally spell it out. So sometimes we think it's implied, like, of course you'll move better and you'll be able to, play with your grandkids and work at your office job and be able to be a weekend warrior on the weekend and not have any pain. We think that that's obvious as musculoskeletal people. It's not obvious. If people haven't had an experience of working at their desk and being in pain and using, topical ointments and sucking down a leaf like it's oxygen on the weekends, they're used to that. That's their reality. This conversation I just had earlier with a practitioner is, we base our reality based on history. We don't base our reality based on what's possible. Often we get to manage our minds and train our minds to look that way and be really cognizant of that, because the brain is beautiful and it's wired for recall. It's wired for recall and it looks for problems. So there's not a whole lot of open possibility and creative opportunities in that type of pre-wiring. We get to manage that and create that, which means if we get to create that for ourselves, then we get to create that for others as we're looking to partner with them, because their brain's wired the same way our brain is wired, on already what's available, not what's possible. Okay, so we talk about this actually in the professional development track as well, that no matter who you're speaking to, we tend to get locked in on the features instead of the benefits. And I love what you're adding here, Gary, because you're a lot in benefits already, which is great. And I'm going to encourage you and all of us to expand on the benefits. What's in it for them, not what is it, right? Like, oh, I do active stretching, or I do PNF, or I do medical massage, or I do Pilates, or I do yoga. Features, feature. No one cares. But what they do care about is, what will their experience be by having interfaced with the work that you do? It's a benefits conversation that you always want to elaborate on. What's in it for them? Clearly and specifically, and elaborate on that, because they can't see impossibility unless they're trained to look that way. Again, because the brain takes us into history, it doesn't take us into future possibility. Well, good, Gary. I'm glad this is landing for you. Great. I can keep going. So is there more to your question, Gary? Again, we're not in an open conversation here, although I do feel you present here, and I love that you're adding into the chat. I'm just going to carry on a little bit more on benefits. We want to always think, whether we're enrolling a client in a new type of treatment than what they're used to. My mastery practitioners deal with that a lot, because now they're converting over to this method, and they still have all this amazing skill that they came with. So you don't have to change, but there's two options. And so how do you convert your clients over to this new option? Again, it's new, it's possibility. You got to be thoughtful about how do you do that through benefits conversation. So the benefits conversation is, what's in it for them? Answer that thoroughly and clearly, and be honest about how vague we are. Like, oh, well, they'll feel better. Okay, great. That means nothing. It's like too vague, right? Like, of course we want them to feel better, but be specific. Be specific. What specifically will they feel better? They will be able to move without pain. Awesome. And then keep going. When they're able to move without pain, what will that create for them? And that's usually where we pause. Well, I just thought we had to stop at the pain relief. Right. Because that's what we're still at a features mind space. What's the benefit for them? Like, literally, what will open up for them in all of its totality and all of the possibility of what's possible for them? Paint this big, beautiful, bright picture that they can't say no to, that they also need your support to see. Because again, we're wired for recall, not in future possibility and bigness. So what's in it for them when they're pain-free? Well, they get to, and then fill in the blanks. And then when they get to do those things, what happens? and keep going with that. So for you, Gary, with your physician, their patients get to have quicker, what are the words that you use? Let me open up the chat again. Give me 1 second. You said, I'm going to use your words because you know this industry. They look better. They have faster recovery. That's what you said, faster recovery, and they're more likely to come back for more surgery. Okay, great. So the patient having faster recovery is what you share with the physician to train them in a benefits conversation, right? Because in a way, think about it, that procedure, that surgery is a feature. What results do they get after having had the surgery and recovered from it is what the patient's really after. Patient's not after the procedure. Nobody wants to go under any type of invasive anything. Nobody wants that. But what they want is what they think they'll have for having done the surgery and the procedure. So you get to train your physician in also a benefits conversation with their patient. If the patients are educated, they're getting multiple opinions. But the physician that sees it from their perspective is the one that they connect with, because we always connect person to person, not data to data. The procedure itself looks better. You didn't say that, Gary. You said looks better. And I'm reading into that the actual surgical site where the procedure was done on the patient's body looks better post-treatment. If that's what you meant, awesome. If what you meant was more like cosmetic and superficial, like, oh, they look better, that doesn't really sell, because the truth is that while people want to look better, they don't want it to end there. They want to look better because they think they will feel something when they look better. So again, always go to the benefits, the feeling, get to the heart of the matter. But if what you meant is the surgical site and the scarring, if there is any, will be mitigated, and that's how they'll look better, you get to share that with the physician, because they don't know, because they don't do your work, just like you don't know how to do their procedure. And like we don't get to pretend like we know what they're doing. You get to be knowledgeable about what they're doing. Like, I know that lipo does this. I know that, these are the types of instruments that are typically used. And you can ask out of curiosity so that the physician knows that you do care about them as well. Because again, you're going to connect to their heart, not to their data. So you get to come in educated and knowledgeable about what they do. If they know that if the physician knows that you know about what their procedure is, then they know that you get them. And then you could say, and then after this is done, physician, the next thing that the body does is this, and that's where I come in. And when I come in where you end, this is that final result for your patient. And then they'll come back for more procedures, more likely to you more frequently. So then there's a value add for the physician, like, oh, if I utilize this person, then my patients, my reputation, my work, my results increase. So that's where you want to go for them in conversation. And Gary, that's landing. Okay, great. I'm glad. So then the next step for you, you're saying that you're getting through the gatekeeper. I'm wondering, Gary, what are you sharing with the gatekeeper? Because there's a reason why the gate hasn't unlocked yet. So what are you sharing with the gatekeeper? And maybe while you're typing in your answer, I'm sure you're sharing with me, Gary, maybe what's happening is it's not what you are or aren't saying, it's your come from isn't clear. So if our come from, again, what we've said here, if our come from is I need and I'm going to go get, then they're like, no, nobody comes and takes here. We're, everybody responds to generosity. Very few people respond to, pillaging. So make sure that even energetically, you're clear with your intention for calling. Like, why are you calling this physician? If it's to get their patients because you need clients in your settings because you don't have enough money, that's a terrible come from, right? It might be true, but that's really not even what's driving you. Like, let's think about this, guys. If some of you are like, well, but Gina, the truth is I do need more clients and I'm not making enough money and I'm working 2 part-time jobs on the weekend, which is notoriously common in our industry. And it keeps me up at night, I'm not going to lie, which is why I teach professional development with such detail. If that is your reality, fine, I get that. And the truth is that you came into this industry as a practitioner from a place of open-hearted generosity. You didn't come into this industry because you liked the feeling of survival mode. So if your come from is survival mode, you're not even in connection with where you really were when you started. So my invitation is, while your reality may be what it is, get back to the heart of why you're here, why you're doing what you're doing. Good, Gary. I'm glad money's not the issue for you. We all get to be in an abundant experience with the work that we do, especially given the work that we do. Okay, so you've been sharing, Gary, so far, features with the gatekeeper. Got it. Here's what I recommend. And it's hard, it's tricky, right? Like, how do I not have a features conversation with a gatekeeper and get to, benefits of the end results when the gatekeeper is the one answering the phone and not actually doing the procedure? So it might, if you're thinking that, normal, that might feel like there's a big leap for you. No matter what you're enrolling someone in, here's a great place to start so that you can get into benefits and leapfrog over features without there being a disconnect. So staying connected, jumping over features, and getting to benefits, even if you're not at the benefits phase of the conversation yet, which I get. Can't always jump to vision right away. Believe it or not, it's my motto. It's ask a question. Ask a question. So if I were to call a physician's office and there was a gatekeeper that I knew was going to answer the phone, I would frame my come from in a question for the gatekeeper to be given pause and then relay that possibility of the question to the physician. So I don't want to put words in your mouth, Gary, but let's say that it sounds something like, is Dr. So-and-so a physician that you know, so now you're appealing to the gatekeeper, a physician that you know to be connected to and interested in the final end results post-surgery? And if the gatekeeper is like, who are you? Well, then there's your no. But if the gatekeeper is more like, of course, it's, again, they're gatekeeping, they're protecting their physician. So it doesn't mean you said anything wrong. You're finding the in with them to find common ground. The common ground is, then you say, I thought so. I thought so. That's why I'm reaching out, because I have something for him that I know does exactly that end result. And I would love to share that with you or with him or with whoever in your office gets to hear it. And chances are you're not going to have a, okay, can you come in at 9 a.m. on Tuesday? Chances are they're going to go, well, what's this thing you have? Because they're going to try to prevent themselves from having an appointment with you. Avoid jumping to features. Well, I do post-surgery lipo and stop. That's how it went wrong in the first place. I promise you this works. Go back to answering them with the same question. Not like, didn't you hear me? I asked you blah, blah, blah. That's not what I mean. If they say, well, what is this thing that you have? You repeat it. I have a skill set and results that prove XYZ is the end result. Whatever the benefit is that you've come up with you and the physician. I've seen it happen. I know how easy it is. And I know that sometimes doctors don't even know that it's possible. It sounds like yours does. And I want to fill that gap. You haven't even said what you do. You're still in the benefits. What's the benefit for the physician? What's the benefit for the physician? You've met them on their values. You know what's important to them. You align with them. You already knew that. You assumed it about him when you called. And you want to provide that for him. You want that end result, that benefit for the physician to be what the physician experiences. And that's how you get through the gatekeeper. They're either going to allow you to come in and either talk to the doctor or talk to them, or they're going to be gruff and they're not your people anyway. But typically we hear a no much sooner than their answer is no. They're typically saying no to your awkwardness or your taking energy, like I'm here to come get something from you. Or they're saying no to your like your awkwardness, nervousness, lack of confidence. So again, remember we said at the beginning, you get to come into any type of conversation with whoever you're enrolling into, whatever work it is that you do. You get to come to the table knowing, I've got this. I've got this. And if you're not yet in that place yet, get training, right? Like get the anatomy training, learn a method, whatever it is that you need to feel like I got it. Literally, I want you guys to feel, every one of you who's here watching live or on the replay, whoever is here working as a practitioner in our industries, I want you to feel ecstatic, almost like you're on the hunt for the next client problem. Because it doesn't matter how difficult it is, you know you've got the solution. And a lot of us, you guys have been so honest with me over the years and sharing with me that you're just like, I feel good about this much, but then when it gets to be like this, I'm not so good. Or I really don't even, yoga teachers say this a lot to me, I don't even really want them to bring me problems. Like I want to know because I want to help, but I'm afraid if they tell me that then I don't know what to do about it, I'm going to freeze, or I'm not going to know what to do. It's totally common. And it's because we don't want to harm anybody. It's not because we're less than, it's because our come from is honest. We want to be in service. We don't want people to hurt, especially under our watch. And I want you guys to feel like, bring me anything, bring me any musculoskeletal restriction, any functional discrepancy, and I got it. I want you to feel like that. And if you don't yet, get training so that you do, so that you can start your come from with that calm, clear confidence. So that no matter what they say, you've got this, you've got the conversation because you know that what you have to offer is wildly valuable. That's how you get to come energetically to the conversation. So sometimes we hear a no because we haven't come to the table with that. It's not about our skill. It's not about even whether they hire somebody or partner with them. It's just the lack of confidence, especially when you're working with people like physicians. They're high rollers, they're heavy hitters. I remember, what's the name of that movie? It's really old. And Alec Baldwin played in the movie, and it was a medical malpractice movie. Maybe somebody here, you can type the name of the movie in the comments. But I remember watching this movie, and it was kind of intense. And I like medical, and I also like legal. Like I like strategic thinking, clear thinking, legal minds. And I also love anatomy, obviously, because this is where I've chosen to be in my lifetime. So this movie had both, and I was super invested in the conversation, and I was really trying to figure it out. I was listening to every word that everyone was saying, and it was a malpractice. So there was lawyers involved, and there was the doctor, and there was the patient. And I remember Alec Baldwin's character was getting pinned into the corner about the malpractice. And his character got very dramatic and said, look, the lawyer was saying something like, who do you think you are, God? Is your ego that big? I'm paraphrasing. Is your ego that big that you think you're as important as God, and that you could never make a mistake, and it's never you, or that you have the right to do whatever you did, whatever the malpractice was? And Alec Baldwin's character lost it in a very dramatic Hollywood moment. And he said, look, when loved ones are on my operating table, they're not God, now I just lost the line. The point, I can't remember what he said. I just remember his face. The point was, they go to the chapel in the hospital and they pray that God give the surgeon what he needs. They're not praying to God, they're praying to the surgeon. And Alec Baldwin's final line on that description was, I am God. And I was like, wow, holy shit. Doctors are, wow. And then I realized, wait, this is Hollywood. The point is, whether you like physicians or not, Gary, I'm super happy to hear that you're in a collaborative mind space around physicians, because we do need them in the world for sure, just like we're needed as well. They have a big game. They have a lot more liability than we do. They've got usually more skin in the game as far as dollars that they've spent for training. And they've got a lot of responsibility. So you can't meet somebody at that kind of vibratory caliber feeling a little less than. It doesn't work, right? Like we talked about that at the beginning. You got to meet them. You got to have your game big. Like, look, I don't know how to do open heart surgery. Don't have a clue, but I know what I know. Bring it. Like you got to come with that kind of confidence, not cockiness, but you got to come with that know-how. Like I know my lane and I have something to offer here. And when our lanes merge, we both get something better from that. And that's the then benefits conversation that you get to come from. So come from a clear, confident space, have the intention, be clear in your own beingness, and then use your language to describe the benefits. And that's it. That's the whole formula. That's how I would approach a position. Gary, I hope that that's been thorough for you. And thank you for letting me answer your question. Okay, loves. If there's more, Gary, please share it in the chat. Let me know if there's more that you need from there. I'm happy to pour into you. And if anyone else, amazing, thanks. Oh, good, you're welcome. I'm glad. Okay, great. And if anyone else here has a question, please feel free to either unmute yourself and ask the question or type it in the chat. I'm happy to answer more. I guess we're on professional development today, which is fun because that's what I wanted to do today. Actually, I'm feeling, yeah, go ahead, guys, and prepare your questions. If you're coming off mute, go ahead and do that. I'm actually going to open up the screen so I can see that. If you come off mute, then I'll know you have a question. And if you want to type it in the chat, you're welcome to do that as well. And while you're preparing your questions, I'll just share with you. I've been in, so we're in a great place inside the academy, inside my training academy, because July is always the start of our new annual year. It's the start of our mastery track for the year, and professional development is just a huge piece of it. And it's so fulfilling for me to have conversations with practitioners who are making the decision to come into the mastery program, because so many of you have you have such skill and such talent, and we get in our own way, right? Like so many of you know what you want and you're hungry for it, and you're still sort of wondering if it's possible for you. and I love being at this juncture right after a group has graduated and they take a sigh, an exhale, and like, oh my gosh, I freaking did it. And then immediately meeting the new track of practitioners coming in with that sort of like optimistic doubt or the skeptical optimism, or however you want to phrase it. And just knowing that like in less than a year, they're going to be exhaling that sigh as well. And a big piece of it is professional development. So I haven't openly advertised, if you will, or marketed the professional development piece of the mastery program, because I thought that, again, benefits, I thought that practitioners would be solely focused on the results that they get their clients. And ultimately we are, for sure. And it was a year ago, just over a year ago, one of my other mastery grads from an earlier track came into our masterclass and said, the professional development is no joke. Like you get to figure out why you weren't making the money that you needed to make, or why you weren't, recruiting new clients at the rate that you knew you could provide for them. You definitely get that in the mastery program. And I realized, yeah, you know what? I get to be more generous and share that that's actually part of the track. Like that is a piece of it. And the reason is because of this very conversation, Gary, that you brought to us today. We all have so much to offer, and we're not, even as solo practitioners, if you're working in your office clinic setting by yourself, even as a solo practitioner, we're still interdependent. The people that you're serving are seeing other people. They're not cheating on you, but there's more that their body, their wholeness needs than just what you offer, and what you offer is amazing. And so sometimes we forget to also interact with and collaborate with other aspects of ourselves and other aspects in our industry. And then when we do have the courage and we think to do that, like you've brought to us, Gary, we realize we don't have the skill to do that. We're not trained to actually message what we do. We're used to creating the results with the person that comes to us. We're working one-on-one, and if you're a movement practitioner and you do, group training or small groups or even large groups, you're used to the results that you create doing your craft. But that integration between who am I in my own belief about myself and my worth, how have I addressed my relationship with money, if I've ever addressed my relationship with money, and how do I really message what it is that I do, or do I just hope for the next referral? And so, hope's not a business plan. So, and being afraid of money or or undercharging yourself. Oh my gosh, if I hear one more freaking practitioner say that they know that they should be charging more, but they don't, the question always, because I ask questions, why? If you know you're worth more, why aren't you charging more? And anything that comes after that, because blah, 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 is a story that's not even based in truth. It's old stuff. So professional development for the win, because we get rid of all of that. We get rid of everything that's after because in the training, so that you can take this amazing way of working and make the great work you are already doing rocket sauce. And so it's one thing to be smart and talented, but if you're not making a good living and feeling really confident about your smartness and your talent, then there's a lack of integrity there. There's some pieces missing, right? And we get to be solid and whole and bring all of that to the table and like click our heels together in joy after every workday. So that's what I'm up to with the professional development piece. And it's totally possible because I've seen it over and over again. In fact, yeah, I don't want to divulge anyone's story because I really want them to share it with you, but we've had some amazing end results this last year. In fact, one of our practitioners, I'll just share this detail and maybe she'll come on and share it as well in one of our Training Tuesdays, but she was overworked. And I didn't know this at the time, but when we were discussing the possibility of coming into mastery, she was thinking about leaving the industry. Amazingly talented practitioner, never should have even been thinking that, by the way, but just burned out, working like a treadmill, working, never making more money, working, always making the same. No, we've all been there. And so, mastery started, and within 8 months, that work over workload ended. And within 11 months of the program, had given herself a raise twice, stopped working weekends, and has 3 family vacations scheduled this year for the first time in her career. So, I'm not making income claims. I'm just sharing with you the transformation is real when we have enough professional development to support our beingness, so that our beingness is as skilled as our skill as a practitioner. Both matter. Just having skill as a practitioner doesn't mean you'll be joyful and living happily, and you deserve to have that. And your people that you serve deserve that too. They want to come in and see what's possible for them through your eyes, right? And if you're thinking lack and less than possibility and sort of like a surrendered sacrifice, energetically, they feel that. They might love you, and I'm sure they do, but you could be experiencing more for yourself, and they'll experience more as well. Okay, and I'm going to end it there. That's the end of our professional development why. That's the come from on the professional development, if you will. I want to thank you all so much for being here. And Gary, thank you for bringing such a juicy conversation and allowing us to talk to everybody while I answer that question, because, when we answer for one, we answer for all. The details of what we do might be different, but we're all in the same game together. So thank you for your generosity and your patience as we unfolded that together. Thank you all for being here live. And thanks, Gary. I appreciate that comment. Thank you very much. Thank you all for being here live and taking your time to allow yourself to be poured into. For those of you who are on the replay, thank you for doing amazing work while we were here live and then coming back to get yourself poured into as well. Appreciate you, and definitely leave comments in the comment section. I read them all and I will answer you directly. So thank you for your contribution in that way. I'm here every Tuesday to serve, so please come, bring your colleagues and your friends, and watch on the replay if you can't come live, but we're here every Tuesday, same time, same channel. And in the meantime, until I see you next, thank you for all the amazing work that you do in the world. The world needs you, and I'm delighted to be colleagues with you. Okay, bye for now, everybody.